All right, once again, good evening, everybody. So without further ado, we have Luca Sergio from Ethos Communications. He's the CEO at Ethos Communications. They do healthcare news, publishing and media, focused on ophthalmology, optometry and eye care, healthcare IT, and mHealth, so mobile health care, which is the whole reason we're on this webinar this evening. So how are you doing today, Luca?
I'm doing well, Aaron. Thank you very much. I'm doing well. Thank you. So I wanted to say just a quick thank you to everyone who's come in to attend the webinar. Thanks for taking the time on a Thursday evening. Also, I'm very appreciative to Jeff Perez, Aaron, to you, to Betsy, for the iMaginations crew for putting together a very interesting series of different folks who have some thinking to share on various subjects of related interest to optometry, ophthalmology, and other medical verticals. And so it's nice to have been invited and to have the occasion to speak about this. It's a topic of some passion of mine, and I just very much appreciate the invitation. So thank you for that. I'll launch into tonight's topic. We're going to be talking about mobilized healthcare, so mHealth, and the provider experience. So from the clinician's perspective, from the nurse's perspective. We'll also be talking a little bit about the patient perspective as well, of course, because that factors into things. Maybe just a little bit of background about myself, just first to kind of set the stage. So, and one question, Aaron, my slides are coming through okay? You can hear me fine?
Yep, everything looks good.
Okay, fantastic. Okay. So, as Aaron mentioned, I'm CEO of Ethos Communications in New York. We are an ophthalmic marketing communications firm. I've been so for the past 20 years. I've been with the firm for about a little over 2 years thus far, and we deal with all different aspects of eye care, from pharmaceuticals and nutraceuticals to surgical equipment to healthcare IT, surgical equipment, etc. And my experience primarily has been on the industry side of the equation. I was VP of sales for Topcon Medical Systems here in the Americas, which is, as many of you may be familiar, a medical device company focused on eye care, specifically diagnostic equipment, healthcare IT, and also under my watch, mHealth. That's kind of where I developed my love for all these nifty gadgets, tablets, cloud systems, et cetera, that we're going to be talking about tonight. Prior to that, in eye care, I was VP of marketing for the German excimer laser company for LASIK surgery, Wavelight, up until its acquisition by Alcon Laboratories down in Texas. I've been in ophthalmology, dentistry, infection control, and healthcare IT now for probably a total of 20 plus years. My love and the reason, I guess, for this presentation this evening is I was really the catalyst whilst at Topcon for the first mHealth app and mini PACS cloud system in eye care, iRoute Synergy. Topcon had acquired a pre-existing company called Anka Technologies down in Virginia. Anka Systems, fantastic technology. I chose to make it the centerpiece of my strategy for Topcon at the time, which was really to capitalize upon their 80 plus years of diagnostic experience, fashioning them or envisioning them more as a data sensor company, and really kind of refashioning them via this acquisition that they had made prior to my coming on board of Anka's iRoute system into more of a cloud data provider. And so we built out a second generation system called Synergy, which is being commercialized now. As part of that, we launched the first mHealth app, which was basically doctor your images, your diagnostic images, anytime, any place. So kind of like this little image that I've thrown up on the slide. It enabled you to review and annotate your diagnostic images on your iPhone, on your iPad, whether you were in a remote office, in a different lane, on your way to a weekend vacation with the family, but just a really, really nifty way to mobilize your information. So I've never, since that experience, I've never really lost my love for healthcare IT. In fact, it's only deepened. And so you'll find me on all over social media, LinkedIn, Google+, Twitter, interacting with and sharing quite a bit of information and learnings that I've been coming across along the way. So I think that's probably one of the things that prompted Jeff and his team's idea that it might be interesting to do a webinar on this subject. So here we are. So that's my background. The objectives for this evening really is to provide kind of an introduction, an understanding, an overview of what is this thing called mHealth, how it applies to both the provider and the patient, to do a deep dive on some of the technology, really just to give an example I think we're all probably aware of some of the more prominent examples that are out there, but really to kind of give an idea of the breadth of activity that's going on in the space. It's really, really a vibrant and very exciting place to play from an industry perspective and from a clinician's perspective right now. mHealth really promises, and we'll go into this, promises a lot of different wonderful outcomes: reduction of healthcare costs, improvement of patient outcomes, deepening of the doctor-patient relationship over time. Of course, as with any technology, and something that many of you I'm sure are intimately aware with, it's not just the tech that gets it done. It's really the human implementation, how it interacts with your day-to-day life that really counts ultimately. But nonetheless, just looking at the tech for the tech's sake and the role it's playing, this will be an interesting exploration tonight of what's available and also to look at some trends, some key needs, and really to have an understanding of what's coming on down the pipe. So as providers, you can begin to ask yourself, what might this technology mean to me? How might I want to incorporate it in my practice? What types of technologies might make more sense than others? Some general things to be aware of. So that's kind of what we're going to go over for this evening. And certainly, as Erin laid out, I welcome any questions any folks may have at the end, or if you'd like to contact me, I have my contact information also at the end of the slides, but I'll welcome any questions. My email address is lmsergio, so Luca Mark, so lm Sergio, S-E-R-G-I-O, @gmail.com. And my mobile, 201-744-3364. So please, contact with me I'd love to continue the conversation. So with that, let's go into this. We'll start off with a little bit of a discussion of what is this thing called mHealth. And I just wanted, although this is a little verbose for a slide, I did want to throw up a discussion, just a comment by the Secretary of Health and Human Services, Kathleen Sebelius. mHealth is the biggest technology breakthrough of our time to address our greatest national challenge. I mean, those are big words, but properly implemented, it should represent quite an advance in the way in which we treat our patients, we approach our patients, etc. It's defined as the provision of healthcare, and I hate to read this, but I'm going to read it through just so we get a definition out up front. The provision of healthcare-related information through the use of mobile devices. Mobile apps and services can include remote patient monitoring, video conferencing, online consultations, so we think about telemedicine, for example. Personal healthcare devices we've all seen, the Fitbit, the Jawbone, things like that. Wireless access to patient records and prescriptions. And it moves on even more towards enterprise-level healthcare IT, something you would use more broadly in a hospital system. So if this is just a general definition, again, what is mHealth from an economic perspective, an industry perspective? I've seen a number of different studies. This URL down here from the UK is indicative of just one. Basically, it should represent a $23 billion global market by 2017. So this is not a small level of activity. There's quite a bit of financial and industry and also clinician interest, as well as patient interest in the space. So it's really kind of at its beginning stages. It's a very exciting place to be. So of this $23 billion, about 11.5 would represent services. And services you can think of as some of the examples that I'll get into pretty quickly. But really that's where a lot of the focus is going to be. 6.6 billion on devices themselves. And by devices we specifically mean things that will attach to a cell phone. So although I'll launch into a couple of examples, ophthalmoscopes, ECG, sensors, glucometers, things like that. So those would all fall into the category of devices. So if this is kind of a sizing of what mHealth might represent worldwide in terms of an economic opportunity, who is mHealth? Who are the players involved? And this slide's a little busy, and I apologize for that, but at the center of the slide you see it's the patient in blue. And our lives, whether in industry, whether as clinicians, they begin and end with the patient. And if you think of the patient as an individual who generates different sorts of disparate data sets, whether they be numeric data, for example, blood pressure measurements or blood glucose measurements, or image data. Now, from eye care, of course, ophthalmology is a heavily image-intensive medical vertical, so optical coherence tomography, scans of the back of the eye, slit map photography of the front of the eye, MRI, etc. You think of the patient generating all these types of data. The people that really interact with and help them generate that data or handle those data sets are going to be everyone from sensor manufacturers to app, so mobile app, whether on the Android Google Play Store or on the Apple iTunes Store, so app developers, or cloud service providers. We at Topcon were one of the first in eye care, again, with the iRoute imaging system. We were handling in the cloud diagnostic images and serving them up anywhere, any place. So that's an example. And healthcare social networks. You have patients increasingly sharing their data with other patients or with family members or caregivers or medical providers, also in a social networking context. So you have the emergence of what we call the e-patient, the electronic patient, who, if he, for example, has been stricken by a rare disease, he goes into an electronic support group to discuss his issue, to share his records, to share his diagnostics, to get feedback and comments, which oftentimes have been proven time and time again to be quite useful information for that patient to then go and use as a basis of interaction with his medical providers. So those are the folks who are immediately interacting with the data that the patient generates. But surrounding all those people are this gray set of circles, from accountable care organizations to the individual doctors themselves, hospitals. We call them payers, the payers being insurance providers who are, because of all this electronic stuff that's going on, are morphing, like Aetna, for example, is a great example of an insurance company that's really morphing more and more into a service provider. Really, they're kind of entering into the healthcare IT space and view themselves less and less as an insurer and more as a service provider. Of course, from a regulatory perspective, we have CMS for reimbursement, we have FDA and the EU governing bodies as well. Pharmaceutical companies are participating and diving in heavily, whether in the provision of information or, there are medication compliance issues that are being explored. Device manufacturers, I think increasingly as a former device manufacturer myself, you see it's not enough to provide a new surgical piece of equipment, but it's more important also to gather data from the activity of that piece of equipment, and then to use that data and represent that data and share that data with other medical practitioners so that a more holistic view of the patient's health situation can be understood. So device manufacturers are very much looking at data exchange. Healthcare information exchanges, which are part of this whole Obamacare push towards greater healthcare IT. Now, naturally, I would be remiss if I didn't mention the electronic healthcare record, electronic medical record companies, PACS companies, picture archiving and communication systems, radiology information systems, moving on to regional healthcare information organizations, and even the doctor organizations themselves, the professional organizations. Like in eye care, we have our American Society of Cataract and Refractive Surgery meeting next week on the ophthalmology side. As organizations, they're looking at the data that they are collecting and how it can be interacted, how it can be used and served up to their membership and to their patients. So who is mHealth? mHealth lives off of data generated from the patient. It's handled by app developers and all, but really the entire the provider ecosystem that's out there are really using this. Drilling down a little more specifically, what makes up mHealth more specifically, a little less broadly than the last slide. So again, we're talking about health apps. We're talking about fitness devices. We're talking about wireless connectors that extract data from a dedicated, let's say, an MRI machine or an OCT machine, and then transmit that into the cloud or into an electronic medical record piece of software. Diagnostic sleds, smartphone attachments, a lot of examples of which I'm going to go into next. Cloud services unto themselves, again, social networking and e-communities that are medically oriented, that are patient-oriented, whether for patient-oriented or whether for provider networks such as Doximity and Sermo. Some of the things that they're doing on an interesting basis is Doximity and Sermo, you think of them as more LinkedIn for the medical practitioner. They're rolling out modules which will enable the clinician to generate referrals or to do the consult in a HIPAA-conformed and HIPAA-compliant, secure, private fashion. So even they are morphing, and they're doing it in a mobilized fashion, so that makes it mHealth. All the way to this term that's been bandied around a lot, big data. Big data means a lot of things to a lot of folks, but think of it as we gather more data about our patients, we're putting them in the cloud, and those data sets can now be accessed and analyzed and understood, and hopefully to longitudinally provide a better understanding of a patient population, say white males, age of 40 with a certain condition, how do they respond to certain drugs, for example. So big data will enable us to get at those, if it's been amassed in a very large fashion, will over time, when also combined with public health data that fits into those data sets, will enable us to get a greater understanding of what's going on with a particular patient population, and are they or are they not responsive to certain therapies, et cetera. So this is kind of what makes up mHealth, broadly speaking, in terms of individual components. But let me, I took some time to put together some slides, which are just some very specific examples. This is not meant to be necessarily a recommendation of any one of these platforms, but it is to give a feeling for the breadth of the type of activities that are out there in the mHealth space right now. So just to move along, we have, for example, here's an example from my space right now, ophthalmology and optometry. Welch Allen bought this company a while back from a gentleman, a clinician, I believe he's from the Deep South, came up with a nifty way to add basically a Welch Allen ophthalmoscope, if you will, to the iPhone in a sled kind of configuration, all to be able to generate retinal images. So you can think of this as a screening device. This is not a heavy-duty $125,000 retinal camera used by a retinologist to monitor advanced macular degeneration. But what it is a wonderful screening tool that's been mobilized that can be used by the clinician, by his assistants, by even a primary care physician or an endocrinologist. So it's a pretty nifty implementation, and it's mobilized. And so once the image is gathered into the app in the iPhone, it can then be transmitted from there. So that's one example. Another example in ophthalmology, these folks are doing something pretty innovative. iDoc app, it's targeted towards ophthalmology and optometry. It's more of an informational portal play, if you will. They have assembled these folks some very nifty databases of all sorts of disparate ophthalmic information that are useful to patients and also to doctors. They also provide an ability to custom skin and provide a doctor with an app specifically for his practice. So this would be patient-facing from the doctor to his patients, but really providing a really good informational baseline from which to begin an interaction. So much of what mHealth is about improving the doctor-patient dialogue. And what is interesting for me is that even though I'm a gadget guy, and I'll have to admit I go out and buy all the latest toys that are out there, the reality is that a lot of patients, even though they may be attracted by the gadgets, oftentimes I think it's very, very important to keep in mind that they should and will gravitate even more towards using those apps and those devices that have been specifically recommended by their medical provider. We call it often here at this doctor-driven dispensing. Really, a doctor should be writing a script for these things. And so in that vein, the folks at iDoc app who have done a nifty job provide the ability for the doctor to really have a deeper ongoing dialogue with that patient once he's out of the office. So this is more of a patient informational communications example. Here's a nifty example, a company called AliveCore. So this is a diagnostic device. It's been cleared by the agency, I believe. And what it is it provides an ECG. One of the gentlemen that I'll mention later on in this presentation as an influencer in the mHealth space is a fellow by the name of Dr. Eric Topol. He's a nationally renowned figure. He wrote a book called The Creative Destruction of Medicine. He's famously been quoted, I believe, in both the Wall Street Journal and the New York Times as being that doctor, that fellow who's on a plane and the pilot says, "Do we have a doctor on board?" Basically, this has happened to him twice, where he was flying across the country, and they announced that. So he immediately said, "I'm a doctor, I'm present," and he whipped out his iPhone. It was attached to his AliveCore device, which has 2 leads. Opened the gentleman's, the patient's shirt, put the leads on there, was able to determine that there was indeed a cardiac event going on, and basically 2 patients were saved because he was able to redirect the plane in time to land to the closest airport so the patient could be hospitalized immediately and taken care of. So AliveCore is a really nifty, mobilized diagnostic implementation of this. It does the reading, it does reporting of the readings, transmission of the readings, really, really cool technology. Here's an example, something that's even more involved and more complex from an enterprise healthcare IT perspective. AirScript is a very interesting company to watch, which has really looked at doing integrations with different diagnostic devices, integrations with different electronic health record systems, all while providing a platform for the information transmission. So you think of them as providing a cloud-based backbone or highway that sucks in information from diagnostics, from, for example, patient monitoring, so pulse oximetry, blood pressure, etc., are pulled into a system and give the doctor in a mobilized format, whether on his iPhone or on a tablet, an ability to look at current vital signs, look at his patient's latest lab results, look at how they might compare from a business intelligence and analytics perspective, how they might compare with other patients in that particular population class. So really a great way for the doctor to get at more information at one time in one place for them to more holistically understand what's going on with the patient. So a pretty sophisticated solution. This is cloud, this is sensors, this is what we call APIs, application programming interfaces to suck in information. Very sophisticated stuff. Another neat example we think of mHealth, really one of the targets is to go after systemic disease like diabetes. Gluco is a very well-funded company. I think they're based out of either Maryland or North Carolina. They have basically a way to suck in from the glucometer of the patient into an app their latest reading. So instead of having the patient having to cumbersomely record or forget to record his information into his logbook, Gluco takes care of that and does that automatically, and then enables you to transmit that to a physician. Hotspace, a number of competitors that are out there, a number of different solutions, but this is a very well implemented solution and a great example of how mHealth can be used on a personal level to provide data from the patient to the doctor that enables the doctor to have a more complete, ongoing understanding of what's going on in the patient's life, not just when he's in the office. Because again, one of the holy grails of mHealth is really, once that patient leaves your office, he's kind of in a black hole. You really don't know what's going on with him. Is he compliant with his meds? What is his blood sugar doing? What are his glaucoma, intraocular pressures doing, et cetera? The promise of mHealth is really to enable the provider to understand on a day-to-day basis, almost in real time, what's going on with his patient. So you can improve care in that way. There's some risks that come along with that, and I'll get into that later. Another nifty company, Cetera Wireless. They have basically, if you think about being a patient in an ICU or anywhere else in the hospital, if any one of you have the experience, you get hooked up with 50,000 different machines. There are cords everywhere. To move you around is burdensome. They've mobilized that. You have a wrist-based solution where on your wrist you get pulse ox, you get you have blood pressure, heart rate monitoring, etc. So all your vital signs are there, and it's cloud-enabled so that it flows through the hospital system and can provide smart alerts to healthcare providers, your clinician or nurse practitioners elsewhere in the hospital. If, for example, there's an event that the system is monitoring. So it's great. It's a device that's wirelessly enabled that's been appified because they can be read out on an iPad app as well. So pretty nifty solution. Here's one that speaks to my background in infection control. I was speaking with the CEO of this company. Very innovative technology. You have here Intelligent M. The product is called Intelligent M, and it's targeted at infection control. Probably one of the number one vectors for disease transmission is what our mamas used to tell us when we were little: wash your damn hands. Well, as we know, in a hospital setting, it's given the pressures of time, rushing in and out of the ICU, what's going on with patients, it's very easy not just to forget, but really, you may wash your hands, but only for 5 seconds. And if you're washing your hands with soap, or if you're washing your hands with one of the antibacterial solutions, the hand washing motion, the Centers for Disease Control have come out with a specific recommendation on how long that should be and the physical motion that should include. So, for example, are you scrubbing down your thumbs very well? If you're not doing that, you're not practicing good infection control. And so it's probably a very significant, it is a very significant vector for disease transmission. So what they've done is they've provided kind of a Fitbit, jawbone up, a vibrating bracelet, which has an RFID tag in it. And basically you go in the doctor in the morning, that RFID tag, you hold it up to the soap dispenser, it pulses twice. That means pulses once, it means it's recording. You go about, and it has an accelerometer like your iPhone has. It has an accelerometer in it. You wash your hands, and then it pulses twice when it says you're done. It's recorded that Dr. Luca Sergio has washed his hands, and he's done it sufficiently. Then when Luca goes into the ICU later on and breaks open a sterile pack with a catheter, for example, that catheter pack has an RFID tag on it. So what do? I register my bracelet with the radio scan. to the pack of the catheter. It beeps once if it's recording. If it pulses me 3 times, that means, Luca, you haven't washed your hands recently. Go wash your damn hands before you touch that catheter. Very basic, but mobilized technology being used to address and close the infection control loop on a very important issue. Great example, great company. These guys have great prospects ahead of them. Here's another nifty idea. So we all know in communication is an issue, and oftentimes using an EMR and EHR system to transmit a request from provider to provider to get that curbside consult, it's bloody difficult. And if you've got to take more than 5 clicks to get there, you're wasting your time. You're already exhausted. You have too many other patients to see. So what's happening in reality today, we all know whether we admit it or not, is that we're sending emails or we're sending text messages of medical data, of patient data. That could be a clinical photo, could be a photo of the patient, it could be a photo of the record. That's a HIPAA no-no. That's a patient privacy violation. We should not be doing these things. And so to kind of address that one simple problem, TigerText, a really innovative company from the Maryland area, has come out with basically secure text messaging for doctors. You can send files and messages doctor to doctor securely. I mean, imagine if you didn't send it securely and you sent a text message to your iPhone, and half the doctors out there are using not just hospital-issued iPhone, but their own personal one. They bring it home at night, or they're like I am in Manhattan. You take a taxi, you go to dinner, you leave your phone in the back of the taxi. Well, then unfortunately, Jenny's patient data is sitting in that lost iPhone. That's a no-no. So these guys are solving a very specific communications problem. Let me breeze through a couple more here very quickly. ZocDoc is an example that you all may know. If you're looking to sign up more patients, they have an app that enables guys like me. If I just moved to the New York area and I want to find an endocrinologist and I want to get scheduled an appointment, I download the app, look for an endocrinologist, look at their register with my insurance provider, make the appointment. It's a great patient flow generation tool for doctors, and that's their business model, is they charge doctors fees for the service, but also a great informational tool for patients. iMaginations themselves, the host of this event, they've done some pretty nifty things. They've been around for a while doing very nifty patient anatomical animations for patient education purposes. They've, of course, mobilized these things. So in a number of different ways, they have a number of different apps, but basically the idea here is, from a patient education perspective, how powerful is it to be able to explain to your patient exactly what's going on with his disease state. So he's coming in and he has, for example, God forbid, advanced macular degeneration, but it's in the dry state. And so the doctor wants to educate him on how it shouldn't proceed to the wet state of AMD. Well, wonderful to have these tools mobilized in an app, in an intuitive format that will provide a very concise but really detailed understanding to the patient. So the patient now will hopefully also, most importantly, be more compliant with what the doctor is going to be asking him to do in terms of his ongoing care. So iMaginations provides great tools in this area and have a wonderful information base to offer. Ping AMD is basically, I've had a son in the past 2 years. My wife is at home. My son Roberto, he develops a rash at midnight. What do? You snap a picture with this app. You upload it to the system along with the chief complaint. Well, it looks like this rash might be red with bumps. Goes up to my doctor in a secure fashion. My doctor then can respond. So my wife is happy, and she gets a response at midnight, which is a wonderful, wonderful thing. Haptique is, in addition to being the iTunes for mHealth apps, is really coming out with something that's very important that I touched on, mobile prescription of health apps. So it has software which will enable you, the doctor, to provide basically a prescription. When your patient comes into the office with diabetes and you want to have them check their glucose, you can prescribe that app via the Haptique platform. Very nifty technology. This is a company that I'll list at the very end of my presentation as one of the influencers in this mHealth space. Vincent Schroeder, the CEO, very influential guy. They run a weekly podcast on mHealth with probably about 80,000 plus listeners. Fantastic show to come up to speed with what's going on in the space. And my last example, really innovative new company that's just launched called Healthcare Mobile. Their target is infection control, and their target is something very basic and different. So instead of washing hands, it's really, we're here to talk about mHealth. Well, mHealth means iPads and iPhones, and I don't know if you all realize, but there have been 8 or 9 peer-reviewed scientific studies from Scotland, from elsewhere in the UK, from New York, from Israel, that have shown that your cell phone carries more staphylococcus on it than a toilet seat. It's actually really disgusting. And we don't think about these things. So if you think about the medical environment, what Healthcare Mobile has provided is a product called the Clean Sleeve. which enables you, doctor, after you've washed your hands, you put on your lab coat, your surgical devices have been sterilized, to have a clean, throwaway, single-use protective cover to your iPad, your iPad mini, your iPhone. Use it, and then throw it away after you visit with the patient. It's a great way to keep your device that you're using all this mHealth stuff with clean. So, hey, another nifty solution that's out there. So those are some examples. What really should mHealth drive is something we call alignment with meaningful use case to behavioral requirements. Really, so mHealth 1.0, as I would term it, was an app for an app's sake. So we got the tech, we've got apps, we have iPhones, it's great, let's put out a bunch of apps. Well, mHealth 2.0 is really not about an app anymore. It's really about putting together apps, sensors, cloud systems, integrating them into a larger healthcare IT system, and integrating them, more importantly, into the doctor's or the patient's workflow or daily habits. And it's about driving behavioral change, driving change that will improve the patient's health, whether that's the doctor, his habits, or whether that's the patient's habits themselves. That's what it's really all about. From a macro level, the major opportunities I see in the space are in chronic disease. So chronic heart failure, COPD, diabetes. 75% of just U.S. healthcare spending alone is spent in these areas. So if you can use mHealth to attack these disease states, you're doing a great service to us all. Again, you're looking to drive behavioral change. And while you're generating all these 50 devices are generating all these wonderful data points, the reality is that they're generating too much. And it becomes, oh my God, I have to listen to all this data. What do I do? So intelligence has to be built into these systems such that the doctor isn't getting pinged every 5 seconds, but rather he's only being pinged if something is out of norm. So if intraocular pressure for glaucoma spikes above a certain level, it's only then that the doctor or the nurse practitioner would be alerted to intervene and make a phone call, for example, of the patient. Trends overall in the space, so, again, this is very interesting. The emergence of the space really is that, there's so many cell phone prescribers, you've got 4G networks out there, so you have a huge distribution system for information, healthcare information, anytime, anywhere, any device. Again, while enthusiasm is focused on apps and fitness sensors really is on driving meaningful change, quality of care, how do you retain your patients. There have been some very interesting studies done by the Veterans Administration here in the U.S. and the National Health Services in the U.K. where they have shown evidence of cost reductions after the implementation of the health system. A problem is the continued lack of interconnection and interoperability between all the different data silos, the databases, the EMR systems that exist out there. But there are meta healthcare systems that are emerging right now to enable people to access those different data sets. Some more trends. Again, it's all about mHealth, and from a buzz perspective and a healthcare 2.0, it's all about mHealth tech and healthcare 2.0 systems, but really the real change agent that's going to be the driver for all behavioral change is data. And we really have to begin and end with the data set that comes out of the patient. And are those data actionable? So can someone take action and change care? Do they have low latency? In other words, does the endocrinologist who needs to receive the data, does he receive that data in a timely fashion so he can take action? And are those data contained within a larger feedback loop such that the doctor not only gives feedback and instruction to the patient, but he understands thereafter what the patient does in terms of a compliance perspective to actually honor the doctor's instructions, and we can then hopefully see whether the patient's outcomes, his health situation is improving. So it has to be contained within a loop. A few other trends here, and of course you can get them on the download of the presentation afterwards. Aging at home is a huge issue. So as more and more we talk about the patient-centered medical home, people aging at home, they're going to be using more and more of these devices to monitor their vital signs and monitor compliance with pharmaceutical treatments, et cetera. That's a big trend that's going on. Reimbursement is an issue, and we'll talk about that in a second. So kind of to boil it down from a doctor-provider perspective, what does he need? He needs an instantaneous view of the patient. He needs a workflow that's been mobilized, that's easy, and he needs tools that are really focused on closing specific compliance loops with the patient. Is he taking his meds? He's been a stent patient, and he should be taking all these other meds afterwards. Is he compliant? Yes or no? If he's not, that's going to be a problem. So how does the doctor close the loop? From a patient perspective, he's going to have needs of self-care information. In other words, he wants to be empowered by more information, but he really values that information that's specifically been dispensed, that's been prescribed by his healthcare provider. He really wants to know the doctor says, check out this site or check out this app, it's a good resource. He wants to have 24/7 access. I mean, you're seeing this pop up everywhere. Some very interesting examples of services that have been coming out. But really, in this kind of economy with Twitter and Facebook and 24/7 access for those types of communications modalities, the patient has an expectation of being able to get feedback. Also, he wants to close that compliance loop with the doctor as well. Some problems to avoid. Adding complexity to the workflow. So although we've got these nifty gadgets, we can't really add too much complexity to the workflow, otherwise they're not going to be used. We don't want the doctor to waste time, or the patient to waste time learning a non-intuitive interface. So if you think about good app design, when you hit your iPad, you want it to be easy. You really don't want to have a deep steep learning curve. You really want to be able to get into the information quickly, and that's the promise of all these touch interfaces. Some have done very well. There's an interesting EMR company down south in Florida called Modernizing Medicine. They're in a bunch of different verticals, including eye care. They have a wonderful, nifty implementation of a touch interface for their electronic medical record system. And you want to be compliant with HIPAA. That's a huge issue. Some barriers to adoption, regulatory uncertainty, reimbursement models that are now starting to evolve. We're seeing basically that CMS has defined some reimbursement for telemedicine applications in a mobilized context. You see progressive payers, insurance providers like Aetna coming out and saying, we will pay for a remote consult, because they realize if they look at their broad subscriber base of their insurance plan, they realize that they have to lower their costs. And the best way is preventative care, and one of the best ways to get at preventative care is via the implementation of mHealth technology. But I think perhaps those things from a regulatory perspective are being sorted out, and I'll talk about that in a second. From a reimbursement standpoint, they're being sorted out. I think the deepest difficulty is really the lack of interoperability between existing healthcare systems. Does this cloud database talk to the EMR? Does the EMR talk to the insurance system correctly? Does it talk to the broader healthcare information exchange? And does it export big data so that policymakers and healthcare providers who are really setting policy and for certain patient conditions and populations can they make intelligent decisions? So that operability is based upon standards like DICOM, like HL7 for demographic information. It's being broken down, but we're not there yet. And so a lot of activity is being focused on that. Until that happens, it's really not going to be broadly as adopted as we would like. Coming to my last few slides, from an FDA and European Union perspective, the FDA put forth, promulgated a guidance document in July of 2011. It was a draft guidance document, specifically on mobilized health apps. It hasn't been finalized. There's been a lot of debate on how do you classify this mHealth sensor, this app. Some clarity is offered by the agency, of course, but there's a lot of debate still and uncertainty that's out there. The EU is debating this as well. Most apps have been classified as Class 1 instead of Class 2 devices, so it's a little bit of an easier road from getting a regulatory nod at CE marking in Europe. But at the end of the day, this can hinder innovation. There are a lot of app developers who are not traditional med tech providers who would be more accustomed to working within the FDA environment. So with FDA comes 510K applications, comes the need to have a quality system in place, et cetera. So a lot of these folks are not accustomed to that. So the FDA is cognizant of this, I think, and they're doing a nice job trying to walk that balanced, fine line on protecting patient safety, because there is a huge valid issue there. One app may not be as good as the next. It may actually be invalid in terms of the medical information provided. So they're very smart to look into these things now, but they're trying to walk a fine line and not hinder innovation. The issues are, does that app re-represent data from a medical device that's being approved? Does it provide clinical decision support? Is it controlling a medical device? Does it create alarms, and if so, how so, and how those alarms communicate to the medical provider so that they can take action? These are all issues that will determine the classification of the mHealth app or sensor, and will determine the regulatory path through the agency and what the agency requires for clearance or approval. Again, quality system requirements are important. Interesting from a Congress perspective, Congress has taken interest. Last month, the Health Committee on Energy and Commerce, there were 3 days of hearings. They were inconclusive, but they were really, really fascinating. Congress has taken an interest in the mHealth space. It raised awareness and scrutiny of what's going on, and really their focus is on benefits of mHealth to the patient, on what's required from an FDA regulatory perspective and how does Congress spur on innovation. I think one of the more forward-thinking fellows in this Congress is Representative Mike Honda, who's a Democrat out of California. He put forward for the 2012 Congress and now is reintroducing for the 2013 Congress the Healthcare Innovation and Marketplace Technology Act. So it's HR 6626 if you all want to take a look. And he puts forth, it proposes the creation of the FDA Office of Wireless Health to really zero in on these issues. It proposes creation of governmental funds for strong innovation. How can we reduce barriers to entry, and how can we even provide financing to doctors to adopt this tech? Like Obamacare provides incentives for the adoption of electronic medical record systems. This act, if adopted, would provide incentives financially to adopt them health solutions. A third issue that's kind of related is certification. So really, the core question is this app medically valid, yes or no? I mean, is it useful? Is it standardized? Is it accurate? Does it provide good information, good readings of the heart's ECG or not? So in addition to the FDA health efforts, or the FDA's regulatory efforts, if you will, HAPTEEK, the company I mentioned before here in New York, has also rolled out what they call their Health App Certification Program. And for those of you familiar with the EMR space, it's kind of like they're positioning themselves as kind of a C-chip for mHealth. Basically, they have their staff going out and providing an imprinted or a stamp of approval on the mHealth saying it, mHealth app saying it is valid, medically valid and useful. I think that's going to be tremendously helpful to a lot of doctors as they begin to prescribe these apps. So with all that information, I'm going to come back to two more slides. This slide is really kind of a summary of what does the future hold, and then like a little video at the end. It seems like we have a little bit of time. I'd like to show it to give you kind of make it all boil it down to brass tacks and give like kind of an interesting vision of the future. But really, from my perspective, what does the future hold for clinicians and medical practitioners? Really, it's going to be a lot more sensors, smartphone sleds, and attachments. It holds the promise of a lot more apps, cloud systems, interfaces with the EMR system, healthcare information exchanges, insurance payers, etc. There's going to be big data, which will give us the opportunity for predictive analytics, modeling tools, and basically what I would call business intelligence dashboards about what's going on in the healthcare system. Clinical decision support systems are out there today, will become increasingly prevalent, particularly if based on big data. If you are looking as a clinician not to supplant yourself, but to complement your own diagnostic skills, it might be helpful to have support systems and software systems that can help you diagnose and make proper decisions about that patient's path of care. We're going to see more remote patient monitoring, which feeds into the patient-centered home, and telemedicine is such a central part of that. Communications, whether it be for healthcare social media or from collaboration tools like Tiger Text, the ability to share and refer patients or collaborate on a patient's care with another provider. Very important. We're going to see middleware emerge, possibly through national patient IDs in the healthcare system. It's being implemented in India on a very broad scale, all to be able to provide continuity of records. I mean, this is where the devil's in the bloody details. How can you understand that a gentleman from, let's say, India, in a clinic in Mumbai is the same gentleman whose images were taken, retinal images were taken in a rural village outside of Mumbai? And how can you match up those records to get a holistic vision of what's going on with that patient? So that's where middleware might come in. Patient communications, self-service, so patient portals are huge right now. Many of you may be rolling these out from your offices to offer your patients more information to schedule appointments, do prescription refills, but also provide information about their ongoing care. The quantified self movement is big. Basically, that means all the Fitbit guys and Jawbone guys are wearing nifty sensors to monitor their sleep patterns, their blood pressure, their athletic activity during the day. And all of this will create the opportunity for a new cloud-based platforms. Platform as a service, as I call it, really, where you're able to provide the doctor an opportunity to have a whole suite of tools that will enable him to address a particular disease state, say diabetes, for example. So that's what the future holds. Let me give you a quick video, and then we're done with the presentation. This was put forth by Kaiser Permanente, which is really, if you love them or hate them, it must be said that they are certainly a wonderful example of a provider-payer network that's come together, wonderful footprint that's out there, and they're really, from an insurance perspective, incentivized to provide new tools to their patients and to the doctors to improve the way in which we provide care. So it reduces their costs and enables them to improve outcomes. This is a vision, a little presentation, about 3 minutes they put together for a NASA presentation actually on health some time ago. Let's just roll the video and hopefully it comes through clearly. So this is a typical day, for example. Something small. My wife is a new mother. You know, you get to pack your asthma inhaler. Fantastic. That's a great example of big data coming in and informing healthcare system within the hospital, resource leveling, and all with a really nifty touchscreen, intuitive environment that enables them to plan staffing levels. Fantastic example. My wife, as a young mother, would love to have that ability to check up on our son's condition if he had asthma. And here we go with something more serious. So a lot of these technologies exist today. Most of them are not well interconnected. They're certainly not as seamless as what Kaiser is putting forth here. Some of the stuff may seem like pipe dreams, but in reality, we're not so far away from some of it. We are further away where it provides the need for integration between different IT systems. But this is kind of a vision of the future. It's goals towards which we can be moving. You get your secure notification for the provider. Their health record shows up in a mobile fashion. Again, it must be HIPAA compliant. So like our imaginations, this is kind of like patient education that we were providing to grandmother in addition to monitoring their vital signs. So it's very interesting. For those of you who love Google and Google Glass, the ability to put a heads-up display into your glass and superimpose those images, that's coming. The remote telemedicine consult, empowered by data that's been shared with the remote physician. And now social media, right? So patients interacting with the hospital and how this hospital wants to create communities of patients and bind them to a continuum of care experiences. We have social media coming in as well. All through the implementation of mobile tools. So this family had an eventful day, but thank God everything worked out because Kaiser was there with all the nifty mobile and cloud systems that they have. So pretty nifty vision put together by Kaiser. I just like to leave you with, here's a slide, and again you can download this. These are some of the folks that I found to be very influential in the mHealth space. Mobile Health News, great news site, Aptique, which I've mentioned. mHealth Insight, another site. Healthcare Mobile, again, this is the site with the innovative infection control sleeve for tablets there. They've been putting out and curating a lot of really good information about the broader healthcare IT and health space. Check them out. Dr. Eric Topol, whom I've mentioned. Dr. Ruchi Das is based out of India, probably one of the foremost thinkers of mHealth as it applies to developing nations like India and elsewhere, where you think of mobile diagnostics being used in rural villages to do screening, healthcare wellness screening. Wonderful advocate, a consultant known across the globe. David, we share a mind in the space affiliated with Aptique. He's, I believe, a cardiologist by training. We spoke a couple weeks ago. Very bright fellow. Paul Saunier is an industry guy, runs out of Southern California, the Wireless Health Group on LinkedIn, a very well-connected fellow. And if you'd like to follow me on Twitter, my handle is @LMSergio. So I'm talking about this stuff daily online and would welcome additional conversations. So please feel free to reach out to me on my email, on Twitter, on my mobile. Love to talk about this stuff. A lot of nifty ideas, and really looking myself personally to meet more folks interested in the space and how we can move this whole thing forward. But always centered around solving specific disease state questions or specific patient compliance issues. Anyway, that's Erin. That's my presentation for the evening. If there are any questions, I welcome.
Wonderful, Luca. Thank you very much. That was very informative. It gave me more information about mobile healthcare, and I think it's a big issue. It's all over the internet. Anytime you Google anything about healthcare, mobile healthcare definitely comes up. So once again, if you guys have any questions, you can go ahead and type them into the questions field, and we can go over them now. But if you think of them after the webinar, you can go ahead and email Luca with the email on the screen, or you can email them to marketing@imaginations.com. So I don't have any questions coming in right now, Luca.
That's fine. That's fine. Listen, I mean, you folks have my contact information. Seriously, I'd love to continue the conversation. So please reach out at any time. And Erin and Jeff and Betsy and everyone down at Imaginations, thank you so much for the invitation and pulling this together. I think it's a really nifty and innovative idea just to kind of share disparate ideas in healthcare with the folks that are out there. And so I applaud you guys for doing it. And thanks for the opportunity.
Thank you very much, Luke. I appreciate you taking the time out to do this with us.
Have a good evening, everyone.
You too. Thank you very much, guys.